Most people assume that managing a chronic illness without pharmacy access is impossible, but that assumption only holds if the system you're used to is always there, because when it isn't, people don't just give up, they adapt, and what's uncomfortable is realizing that this has already happened not in theory, but in real life. There are places where pharmacies stopped functioning normally. Medications became scarce. Supply chains broke down. And people who depended on daily treatment suddenly had to figure things out on their own first. The reaction is predictable: panic, because chronic illness isn't something you can pause. It doesn't wait for systems to recover. It demands consistency, routine, precision. So people start doing what seems logical: they stretch their medication, skip doses, cut pills in half, try to make it last longer. And for a short time, it feels like control, until it doesn't. Symptoms begin to fluctuate. Some days feel manageable, others don't. The body becomes unpredictable. And that unpredictability creates a different kind of stress, not just physical, but mental. You start questioning every decision. Was that dose too small? Too late? Too early? And the worst part is, there's no immediate feedback loop you can trust. So people try something else. They look for alternatives, different brands, substitutes, anything that resembles what they used to take. Sometimes it works, sometimes it doesn't. And when it doesn't, the consequences aren't always immediate, which makes it even harder to connect cause and effect. That gap between action and outcome creates confusion, and confusion leads to trial and error. But here's where things get more complicated, because the real challenge isn't just the lack of medication, it's the loss of structure. When pharmacies are accessible, the system handles a lot of invisible decisions for you. Dosages, availability, storage conditions, timing. It's all standardized. Remove that structure, and suddenly you're responsible for variables you never had to think about before. Storage becomes a problem. Some medications require refrigeration. Others degrade with heat, light, or humidity. And if those conditions aren't stable, which is often the case during power outages, effectiveness starts to change, not overnight, but gradually. And that gradual change is dangerous because it's subtle. You don't immediately notice that something isn't working the same way anymore. You just feel off. So people adjust again. They rely more on observation. They begin to pay closer attention to symptoms, not just the obvious ones, but patterns, timing, triggers, small changes that used to be ignored. In a way, they become more aware of their own condition than they were before. But awareness alone isn't enough, because without a framework, it's just data without direction. So the next layer emerges. People start learning, not casually, but out of necessity. They look for ways to understand what's happening inside their body, what different symptoms might indicate, what actions could make things better or worse. And this is where a shift begins, because instead of reacting to problems, they start anticipating them. But here's the part most people misunderstand: the real issue isn't that people don't have access to pharmacies, it's that they've never been taught how to function without them. There's a difference. Point one is a resource problem, the other is a knowledge problem. And when you look at situations where medical systems become unreliable, the people who manage better aren't necessarily the ones with the most supplies. They're the ones who understand how to use what they have. They know which symptoms require immediate action and which ones can be managed. They understand basic treatment principles. They recognize when something is getting worse and when it's stabilizing. And that changes everything, because instead of guessing, they're making informed decisions. Now, that doesn't mean they replace doctors. It means they bridge the gap when doctors aren't immediately available, and that distinction matters, because without it, people fall into extremes: either total dependence, or complete improvisation. Neither works well. What actually works is something in between. A grounded understanding of how conditions behave. A realistic view of what can be managed at home, and what can't, and a structured way to respond when things change. That structure doesn't eliminate risk, but it reduces uncertainty. And when uncertainty goes down, decision-making improves, which brings us back to the original assumption, that managing a chronic illness without pharmacy access is impossible. It's not, but it is unstable without the right knowledge, because what people are really trying to do in those situations isn't replace the system. They're trying to compensate for its absence, and compensation only works when it's based on understanding, not guesswork. That's why, in situations where access becomes limited, the most valuable thing isn't just having supplies stored away. It's knowing how to think, how to interpret symptoms, how to respond without overreacting, and how to maintain some level of control. even when the system around you becomes unpredictable. If you want to explore this deeper, there's a structured breakdown in the description that walks through these scenarios, including how people adapt when access to medical care becomes limited. And if this kind of topic is relevant to you, consider subscribing, because the more you understand how these systems work and what happens when they don't, the easier it becomes to navigate them calmly.